Okay, hey, I'm Dr. Sean Tierney. I'm a musculoskeletal sonologist, and I work a lot with regenerative medicine. As a result, I talk about regenerative medicine quite a bit. Now, this particular product we're going to talk about is something that we use frequently in the offices that I work in and I guide procedures in, and that's placental tissue matrix allograft by Skye Biologics. It's called BioVeneer, and it's something that we can use to regenerate tissues that have been injured and haven't healed. Now, we've been doing this regenerative medicine for a long time. The first thing that we really started to use was PRP, or concentrated platelets from people's blood, and we put their own platelets back into the areas that are not healing to stimulate them to heal, which is quite effective, and it was one of the first things that was used as a biologic in regenerative medicine. And then the next thing that came along was using bone marrow. So we get the stem cells and growth factors from bone marrow to grow new tissue. And that's also effective. Both of those products have a little issue, which is they do cause a flare and a lot of pain after the procedure, which limits their use in an elite athlete that has to go back the next day, or somebody who has to get better quickly or go back to work sooner. That's a little bit slower than if we were to use placental matrix. And the effectiveness of placental matrix seems to be overall, in many cases, better, depending on what the target is and what we're working on. So we need to choose from different types of regenerative medicine. There's also fat stem cells that we've used quite a bit and taught on, and a lot of placental cord blood stem cells we've also used and taught about. So we teach about all these things. The primary thing that I do teach is ultrasound diagnosis and procedure guidance. So when we talk about placental cord blood, when we compare it to those other things, what we show is that, hey, there's a little bit less flare. That means that you don't have that severe pain after the procedure that you could have after a stem cell procedure with bone marrow, or with placental matrix, or with, not with placental matrix, but also with bone marrow or with PRP. So we have less flare, there's less downtime, and usually there's a faster decrease in pain. So you have more relief with placental matrix versus bone marrow or PRP, and also versus other placental matrices, allografts that we have used in the past. This is the only of those placental products that's actually FDA approved and FDA indicated for regenerating connective tissue injuries. So the nice thing we like about it is also there's no prep time. So if we have a patient that comes in and really needs this, we don't have to schedule a different day for them. We're just going to open up the bottle. It's at room temperature stored. Open it up and drop solution and use it right in the spot for an effective treatment that can get somebody back quickly. So there's no centrifuge. It's not refrigerated, and it's the fastest return to sports. You can get it to your office pretty quickly. So far as for special forces, it's pretty big in special forces. You can take this in the field. You can take a lot of these doses in the field with special forces operators to treat them on the spot, treat them in country, downrange when they have injuries, and start their process of getting better a lot quicker. The nice thing about this is also it's a bacteriostatic and antibiotic properties, prevent infections, so you increase healing time, you have less risk. There's no living cells in the product, so there's no chance of racking to some foreign DNA. The product is completely sterile, and so far as regenerative medicine, it's very reliable, and the practices that I work in California and across the country, probably the most reliable overall. That's better than other things, but it's a very consistent product so far as reliable results, and we track the numbers. The numbers look good. So this is made from the whole placenta. There's a lot of amniotic products that are just made from the amniotic membrane. This is a more whole placenta concentrate, so it's going to have that whole placental usage, and that's made from healthy placenta. It's still sterilized. It's from healthy placenta that have never been through the birth canal, so it's C-sections only. Keeps that product cleaner. Of course, the donors are screened very carefully. The tissues are screened very carefully. And they're even at that point, they're still further sterilized. So you have a safe, sterile product that's free of a risk of infection, and free of foreign foreign DNA, so you're not going to have somebody else's DNA in your body, and you're going to have a lot of growth factors from placental stem cells, a lot of factors that attract more of your own stem cells to the area, along with a very effective matrix of connective tissue, what makes up bones, tendons, ligaments, and the connective tissue around nerves and joints as well. So you have not just the amnion, the chorion, the placenta, the umbilical cord, and the amniotic fluid are all used and then dehydrated but not dried out. So you have a concentrated fluid product that's sterile and has biologically active cytokines, biologically active chemicals that stimulate regeneration for a long period of time. So you're going to get that connective tissue matrix. So all the things that are in that connective tissue, from fibrin, laminin, collagen, growth factors, all in one group, and it's in a fluid. It doesn't have to be rehydrated. So you have a very effective product. And the most important thing about this product, from my perspective, is results. So there's a lot of products out there, a lot of placental products out there, but that are not as reliable as this. As much as we've tried and we're testing, and we're still testing other products consistently, but we've had the most success across the board with this matrix, and it's the complex nature of the connective tissue and the growth factors that I think that seems to make the difference. And you have more cells attracted to this than any other type of regenerative medicine products as far as the chemotactic ability. So as far as testing has been done to date, that is. So we have what it takes to stimulate growth. We have connective tissue. We have the matrix, the ground substance for things to grow on. And we have this thing that works quicker than other therapies with less pain, and you get back a little bit faster. There's also a little bit of an immunosuppressive property, which is relative to a lot of types of arthritis and degenerative disease and chronic inflammation, because in a lot of those cases we have a mild autoimmune disease going on. And that autoimmune disease is modulated by stem cells and modulated by this product, so that those people that have rheumatoid arthritis, that have lupus, scleroderma, and that it's affecting their connective tissue, we see much better results with this product than using this patient's own bone marrow stem cells, or PRP, because those products, when we use them in a procedure, causes more inflammation. If there's already an autoimmune inflammation happening, it tends to make it worse. And that may be why we get a lot more consistent results with this, because a lot of those osteoarthritis, a lot of that chronic inflammation may have some mild autoimmune effects for even people that just have regular osteoarthritis. So there may be this mild autoimmune suppression that helps things improve. On top of that, well, if it's suppressing my immune system in some way, am I at a greater risk of infection? And the answer is no, actually. It suppresses infections, it suppresses bacterial growth and viral growth, and it also suppresses yeast growth and different kinds of fungus growth. So you have this antimicrobial that modulates your immune system in a way that you can heal faster, stimulates you to heal, and it has the connective tissue that's required to build new tissue. So you have building blocks of new tissue, growth factors that stimulate it, factors that block unhealthy inflammation, and factors that prevent infection. So we've seen some amazing results in this in surgery. And a lot of people that I talk to, a lot of physicians that I talk to, are saying, well, that's something new, I'm not sure that I want to step into that. But the reality is, when you start to work with this in the hospital, in most cases, or in many cases, hospitals are already using this product. Now, they're not using maybe the flowable product, but this is they also make a non-flowable product that's like a wrap. So you can use this placental matrix from the same company, with the same processing from the same lab, to produce a nerve wrap or a tendon wrap that is going to help nerves and tendons heal faster. So you can, if there's a nerve that's been severed, you can wrap the nerve in this nerve wrap. That's going to stimulate faster growth. If you put the flowable matrix around it, even faster growth of the nerve. And we show that that's significantly more, 16 times the axonal growth with placental matrix around the nerve versus without it. So significant change in neurological regeneration that we can achieve with this Hydrotex BioRenew product. So we're happy about that, and we're happy to see results in our patients, more important than anything else. So I don't sell this product. It's not my product. I don't make any money on it if anybody buys it. What I really sell is teaching ultrasound and getting more doctors to learn ultrasound well. And this becomes relevant because if you know what the problem is, and you have a precise diagnosis with musculoskeletal ultrasound, and you've done a diagnostic test to prove where the pain generators are from, you can treat that exact injury very carefully, very clearly, with a high success rate using this product. So, what do we have? Well, we have amniotic membrane, amniotic fluid, umbilical cord, but we're going to get all these different types of collagen. And the interesting thing is undifferentiated collagen, so it's a little bit rawer form, more usable form to our bodies. Fibronectin, lignin, lamellins, proteoglycans, hyaluron, growth factors, all those things that are relative to make this matrix, because it's not one thing, it's a matrix, it's everything that's required to regenerate tissue, or to stimulate tissue regeneration in a relatively healthy person. This product standardizes all their samples to have these growth factors in an adequate quantity. So if you get this product, it seems to be consistently effective, and that may be because it's been tested to make sure that these growth factors are in that product. So those are some of the 280 anabolic growth factors in the product, but these are the commonly studied growth factors. So we not only have a scaffold or a matrix of connective tissue to grow new tissue, we have growth factors, and we have cytokines that attract new stem cells and tissue producing cells into the area. So we can modulate the immune response, block inflammation, inhibit these chemicals that break down tissue like metalloproteases. We can increase growth, we can increase tissue growth and proliferation, increase vascular regeneration, and increase tissue remodeling. So we have all of the factors that are required in one product to work effectively. So do we have to mix it with something else? No. And generally in the practices that I work in, it's a standalone product. It doesn't have to be mixed with platelets, doesn't have to be mixed with stem cells. I mean, you can, but it doesn't have to be. We generally have not seen as good a results if there's an inflammatory state if you mix it with platelets. If there's not an inflammatory state, platelets can be helpful. So this is a way that we're getting results without surgery, a way that we're getting results that decrease pain and decrease scarring. So now we get into what I do. What I do is examine tissue, get a good diagnosis, help guide procedures, and ultrasound is a vital part of that. So we need to use a precise diagnosis to use this product because it's a very expensive product for its volume and needs to be placed in the injured tissue. Here's an example of a tear. This is a bicep tendon tear, and one of the doctors we work with on a regular basis. Had been there for about a year and a half. He had about 1/10 of the strength in that arm, and this is a very muscular athlete, bodybuilder type doctor, and he had 1/10 of the strength in that arm, and within a week he said it felt like the other arm, and now that's his strong arm. Within a month, I think he was back to lifting the same weight on both arms, and that's the better arm of the two so far as bicep strength at this point. Here we can see a cervical facet joint, and let's see if I can get that to work for me. And then the next one is, so we could inject those cervical facet joints with placental matrix, and that's one of the more effective things that we've seen. If you can see, here's a needle coming in to this arthritic joint, and if I get the video to flow, you can see the fluid flow around there. Let's see if I can get that to apparently not. And here we can see the spinal cord underneath the inferior oblique capitis. This is access to the spinal cord. with ultrasound. So if you're going to put something around the spinal cord, this would be the way to do it. As far as the upper cervical spine, this is the posterior rami, anterior rami spinal cord. You can actually see this pulse with the cerebral spinal fluid moving around it. Here we see a case where somebody had torn their PCL. It was an elite professional athlete, had torn the PCL. Now there's no visible structure in this area. And a couple months later we can look and see, hey, there's some structure in that area. So now we have regeneration of that tissue. That knee, that PCL became completely stable, and it doesn't bother him at all anymore. Correct. It's been years, so one-time treatment. Here's another, this is a biceps femoris, short head tear, and that creates a little bit of that instability in anterior lateral rotation, anterior lateral instability. And you can see a lot of that tendon was torn. There's very little structure in that area. A couple months later, we can see their structure, and here you can see it's completely normal. It's completely filled in with connective tissue. So we've seen some good results, and the initial things that we really saw changes that exceeded other forms of regenerative medicine with the same type of procedure was with AC joints, facet joints, Farr's defects, single tendon, single ligaments. So we've seen some pretty amazing changes with this. Now, regenerative medicine, when done well, can get amazing results. The difference is we've seen just better results with placental matrix for these issues than with other forms of regenerative medicine that we use so often. So when we're dealing with diagnosing a problem, we have to think, what product is going to be the best for handling that particular diagnosis? What's going to be the best product for that fits that patient, fits their situation, is going to have the best results and to be the most cost effective. And a lot of times it ends up being placental matrix, sometimes it's other things. There's not this this fastness of level 1 studies like there actually is with PRP right now. So we don't have as much research behind it, but the clinical effectiveness is outstanding. So people that are experts in the field of regenerative medicine are moving in this direction, and the research is definitely building. Now the research on how it works and the effectiveness and chemotactic factors and the antibiotic factors is fairly effective, fairly good. But as far as the regenerative medicine studies, they don't have the volume of studies. You're not going to have that level 1 overall study for this procedure, these procedures. So now a lot of the placental products are gone because there have been some problems with other placental products. So just an example, there's amniotic membrane products that are going to try to get those growth factors, those cytokines from the amniotic membrane. They still exist. I don't think they're as effective, at least that we've studied so far. There may be some products that are, but we don't know of them clearly. There's the amniotic fluids and amniotic membranes, and the amniotic membranes. A lot of these dehydrated membrane products are actually off the market. A lot of them caused a lot of pain and were not as effective as we would like. Some of them are still around. This BioRenew is kind of a complex of everything that's required, everything beneficial from the placenta. It seems to be the most effective, and it's also the only product that I know of that's FDA approved and FDA indicated for regenerating tissue. So far as safety goes for a physician, it's hard to argue with something with this product, whereas other products, maybe there's a question with the FDA of, is that the right thing to do or not? So. Placental products have been around for a long time. I think this used since 1920, that's the United States. I think that in Asia they've been using them for thousands of years. My friend is a very top hand surgeon, and he initially was not interested very much, didn't have much interest in regenerative medicine, but he was really excited a couple years ago about the results he was getting from these nerve wraps and tendon wraps, because he was getting nerves to come back. One of the things that he does on a regular basis is reattach limbs, reattach an arm, reattach a hand. that's an exciting day for him. He's like, I had a great day, I reattached the hand. Well, that was a good day for you, but somebody had a bad day. But thank goodness you made it a little bit better. So those tendon wraps, those nerve wraps are something that he used a lot, and he said, this is great, it's PMA nerve wrap, that's placental tissue matrix, placental matrix allograft is what he was using. So he didn't realize he was using that product, and what happens is a lot of these hospitals are already using these Skye Biologics product without knowing it. So if you want to get something through a hospital, it's already been approved by most hospitals, so it's a lot easier to get this product into care. Obviously for corneal surgery, for wound care, a lot of studies on wound care, for open wounds, for diabetic ulcers, seeing some results with this placental matrix that are outstanding compared to other forms of regenerative medicine. Certainly with the spinal and dural repair surgeries, that's something that placental matrix has become used for, especially for these dural wraps. So if you have a spinal surgery and you wrap the dura, or the sheath that surrounds your spinal nerves and your spinal cord, you have a lot less scarring, you have a lot less risk of problems after the surgery, a much lower risk of infection, and a much lower risk of spinal fluid leakage. So that dural wrap would be something that I would like to have if I was going to have a patient get a spinal surgery where the dura was being penetrated. Nerve wraps, of course, we talked about. The tendon wraps we talked about. A lot of the orthopedic surgeons were having a couple of hard time a year ago because insurance companies were denying these tendon wraps, and they were saying, well, we get 3 times the healing. So you cut your healing time in 1/3. That saves a lot of money. Still, there were some issues with insurance companies. I think that's starting to go away now. So the studies are available at Skye Biologics. There's a little study that was done initially, and I think this is not a good generality, but this is a study that was done showing how fast you get relief. So you can see there's significant relief of pain oftentimes, but not all times, within the first week. So you tend to have this gradual reduction in pain. In reality, what I see with regenerative medicine as a whole is usually it's about a 12-week window. I don't judge it before 12 weeks. This is what I see a lot of times with a young athlete, but on average, and for myself, a lot of times I don't see results until you get to the 10-week point. It's not unusual that somebody feels better in the first week or two, but that doesn't mean as much as the long-term results. Certainly you're not going to see the structural changes within as far as things have regrown, so a tendon or a ligament or a disc, within 1 week. It takes time for that to occur. So I usually say we're going to see changes that go from 3 to 6 months. So the 12-week point is where we can make a judgment of how effective that procedure was. If there was a lot of damage done, you may want to do multiple procedures before we get to that point. But you have to make your own clinical decision, and for patients, you have to go with a doctor that you trust.